Atropine. The parasympathetic off switch. Blocks the rest and digest system. Right pointing arrow turns on fight or flight effects. 1. Clinical uses. When and why we use it. A. Slow heart bradycardia. Example. A patient's heart rate drops to 40 bpm after a heart attack. Right pointing arrow atropine 0.51 mg IV speeds it up by blocking vagal parasympathetic signals. B. Excessive secretions. Pre-anesthesia, poisoning. Example. Before surgery, atropine 0.4–0.6 mg IM dries up saliva. To prevent choking. Poisoning. Organophosphate. Pesticide overdose causes flooding of saliva, tears, sweat. Right pointing arrow high dose. Atropine 2–6 mg IV blocks this. C. Eye exams. Pupil dilation. Example. Eye doctor uses atropine drops to dilate pupils for retina checks. D. Stomach bowel spasms. Example. Severe IBS cramps. Right pointing arrow atropine relaxes gut muscles but rarely used now due to side effects. 2. Dosing. How much? Bradycardia 0.51 mg IV. Heart rate less than 50. Right pointing arrow give 1 mg. Repeat every 3 to 5 minutes. Organophosphate poisoning 2 to 6 mg IV. Farmer exposed to pesticide. Right pointing arrow give until secretions dry up. Pre-anesthesia 0.4–0.6 mg IM before surgery to prevent drooling. Eye dilation 1 to 2 drops. Eye exam at the optometrist. 3. Contraindications. When not to use. Hot, blind, swollen, fast. Hot. Right pointing arrow fever blocks sweating. Right pointing arrow overheating. Blind. Right pointing arrow glaucoma. Up pointing arrow eye pressure. Right pointing arrow can cause blindness. Swollen. Right pointing arrow enlarge prostate. Worsens urinary retention. Fast. Right pointing arrow tachycardia makes it worse. Example. A glaucoma patient complains of eye pain. Right pointing arrow giving atropine could dangerously increase eye pressure. 4. Side effects. What goes wrong? Can't see, can't pee, can't spit, can't shit. Can't see. Right pointing arrow blurred vision. Pupils dilated. Can't pee. Right pointing arrow urinary retention. Common in older men. Can't spit. Right pointing arrow dry mouth. No sweat. Can't shit. Right pointing arrow constipation. Gut slows down. Example. An elderly man takes atropine. Right pointing arrow next day he can't urinate and is confused. Anticholinergic toxicity. Atropine overdose equals mad as a hatter. Mad. Right pointing arrow confusion hallucinations. Dry. Right pointing arrow no tears, sweat, saliva. Red. Right pointing arrow flushed skin no sweating. Hot. Right pointing arrow fever can't cool down. Example. Child eats deadly. Nightshade contains atropine. Right pointing arrow hallucinating. Dry. Feverish. Right pointing arrow needs antidote physostigmine. Summary in one line. Atropine blocks rest and digest. Right pointing arrow speeds heart. Dries fluids. Dilates eyes, but don't give if hot, blind, swollen, fast.